to the second part of Pilates and physiotherapy, and it's not just a fitness trend. So let's dive deeper into this. Next slide, please. Yeah. So flat abs. This is an exercise where, if you can see, the beginning of the exercise is we are training the patient to achieve the curl up till your superior scapular border. Here, but if you can just notice, we are instructing the patient to contract your core muscles till the extent, but yeah, make sure if your patient should not hold the breath. There should not be any Valsalva maneuver. The patient is supposed to breathe out, exhale, and or he or she can count 999 when exhaling to ensure that there is no breath holding which is taking place. So this is just an form of exercise we give in Pilates, that is flat abs, neck peel, and the patient is in procline. The next slide is when there is surgical case we are handling. So many a times, as you can see, the patient is having prosthesis. He is a below knee amputation person, and when the therapist is trying to train his core muscles along with making him realize that how important it is to balance his posture. When the results come up, we can see that yes, it is easy for the person who is below knee amputation along with prosthesis to get accustomed to this new prosthesis, orthosis. Along with this, he will be able to walk as a normal person. So it is really a boon that when the person is walking where the kinetic chain is properly arranged, the walking pattern won't be faulty. It doesn't make a difference between a normal person and a person who is specially abled. So yes, for amputation patients, for prosthetic cases, not only for lower limb, but yes, even for upper limb, Pilates exercises does work like a miracle. And you're not only the abdominal muscles, but entire trunk muscles and your lower extremity muscles, large group of muscles, hamstrings, quadriceps, all these muscles are co-contracting so that the strength is also improved, and also there is much of the awareness to the patient that yes, when walking, the gait cycle is improved because all these muscles are working into coordination. So Pilates help us to gain this. Next slide. And Pilates definitely works on your, rather on these large muscles, but definitely on your neck muscles also. Anterior neck muscles, posterior neck muscles, bringing the head of the patient in center. And then once this is achieved, many of the time, the person who are having rounded shoulders or having a lot of upper back pain or thoracic spine pain, so this pain is being reduced along with the adjuncts which we use, like electrotherapeutic modality. So Pilates exercise along with these exercises have shown wonderful result. There is a case study of non-specific low back pain. A 45-year-old female with chronic low back pain presented with weak core muscles and poor postural alignment. She underwent 6-week mat based Pilates program, which was performed twice weekly under physiotherapy supervision. If you could take a note that this is twice weekly. In a week, twice if you're doing the Pilates session, I won't say it is enough, but yes, it will. Uh, if you include Pilates in the daily exercise regime, few of the exercises, so definitely it will make a difference. And weekly, because Pilates, yes, it is a high intensity exercise. Initially we train the patient for to getting adapt to Pilates exercise, and later on these high intensity exercises are being incorporated in his daily activities also. So it should be also it should we should take it under supervision initially. And outcomes which we got are significant improvement in core strength, reduced pain levels, and enhanced overall quality of life. When functional scales were taken on that questionnaire, we found out that yes, when we were giving her physiotherapy treatment, that time she was showing improvement, but improvement was not long term. The female was again coming back with the same low back pain. Later on, when Pilates was incorporated, that time I would like to add one more thing, that we were even giving her Jacobson and Mitchell relaxation techniques. So together, this entire protocol in a week, twice Pilates, then exercises, and then the relaxation techniques worked magically good for her. So yes, her recurrence rate was lower, and now she is free from pain. So it does make a difference. Next slide, please, ma'am. Yeah. So for geriatric patients, from community-based rehabilitation point of view, uh, older the individual gets, the more chances are there that the coordination is being disturbed or altered. Rather than disturbed, it is altered somehow. So to make the person confident enough that he or she can still lead to normal activities of daily living in his life, is to engage the patient, to make him aware that yes, his posture is correct and now he is not going to get you pains. We have even seen that our society is more considerate towards making the surrounding more comfortable and more helpful for the geriatric population. Along with that, if we could train the geriatric population that yes, few of the exercises you can still do it now, along with the breath control training, it will give the confidence to the geriatric population, and they would definitely do these exercises repeatedly, and longevity of their life will improve. And not just actually, now this time the quote would come that it is not physiotherapy is not just adding years to life, it is adding life to years. So for geriatric population, it will make a difference, and it is making a difference. Many of the dance forms, aerobic exercises are also including Pilates training for geriatric population, so that they could feel uh, better in their own body and comfortable in their own body in spite of the advancing age. Next slide. Next slide, ma'am. So upper body sparkles. There are many of the fancy names which are used in Pilates for specifically for upper limb, for lower limb, for neck Pilates, for lower back Pilates. So these exercises, if we are making a protocol for a patient, I would suggest we should make a protocol with respect to his or her condition. Pilates does make give us an yeah that okay, fine, you can overall try to cure the kinetic chain of the patient, but initially just try to focus on the affected part, and later on, yes, we can try to completely approach towards the kinetic chain of the body. So upper body sparkles is nothing but you have to, the person is going to take weights. It may be resistant bands also, therapeutic resistance band, or it can be dumbbells of 1 to 1.5 kg, and you can even advance the weights. So these exercises are something in every body posture. If you're lying, you have to engage your core. If you're standing, you have to engage your core. And if you're doing any of the extremity movement, you have to engage your core. So that training for the patient has to be started from day one if we are planning for Pilates. And Pilates, uh, to be honest, we would take at least 1.5 week or 2 weeks, not less than that, to teach the patient how to actually engage the core muscles. Once we teach that, once the patient is able to individually engage the core muscles and then do the extremity movement, it will make a difference. And the patient himself will say that, yes, now when I do upper limb movement, now when I do neck movement, I don't feel much of strain because the entire load is being targeted on the core muscles and on the anterior hip muscles, on your glutes, on your quadriceps, and on your hamstrings. So, next slide. And these exercises, even if, next slide, please. So, lower body knee side kicks, or yeah, lower leg swings. So lower body leg swings is something here. Few of the, if you remember about the few of the yoga postures like Tadasana and all these postures, this were helpful in maintaining the balance of the patient. Thereby, now in Pilates, you can ask the patient to begin with the non-affected side and then progress it to affected one. And when the affected side is trying to maintain the balance in such postures like improving the stamina in the wall chair position, or leg swings when we are balancing on one individual leg. So that time, the patient need not have to engage the core actively, but it is unconsciously activating your core. And that time, the patient would feel that yes, the strength is being exerted not by the extremity. The load is being felt not on the extremity, but through the core region. But this comes to a point that every time engaging the core, will it be won't it be painful, or won't it cause any kind of affection on the lumbar muscles? No, it won't. Initially, when you're training the diaphragmatic muscles, the lumbar spine muscles, erector spinae, and all these muscles, initially you would feel that yes, the muscles are getting sore as we start up with any of the strengthening protocol. Later on, when the patient gets used to it, as the muscles are toned up and as the strength of the muscle is improved, it would be helpful rather than uh, inviting a new pain. So it won't cause any of the issue in your lower spine or on your anterior thigh muscles or such. Next slide, please. Yeah, as you can see, the stamina wall chair, you can even use weights in your hands and then ask the patient to support, to make the movement when you are maintaining this position. So co-contraction of your quadriceps, of your hamstrings, and this also improves. The earlier picture was also improving the ankle strategy and the hip strategy, which is crucial, which plays a crucial role in gait training and in building up the stamina, and even training the person for a proper gait, proper ambulation. So yes, this does makes a difference. Now, evidence-based research, as per an article by Cruz Diaz, recent studies, they supported the effectiveness of Pilates in rehabilitation. Cruz Diaz has found that Pilates significantly improves pain relief, postural control, and core endurance compared to conventional physiotherapy. When it comes to strength, it is something which is co-contraction, repetition. But no, co-contraction can be for strength training, but repetition is definitely for endurance. And strength training, if we have achieved a certain level of strength training for a particular patient, maintaining that strength for quite a longer period of time will require endurance training. Endurance will only be achieved once you are repeating the similar posture, similar exercises, and then the patient is doing it in his activities of daily living or any of the job profile he or she must be. Once he learns to engage the core and perform few of the Pilates exercises, including the lower limb, the upper limb, even for matter cervical spine. So yes, the postural pain, which is a frequent condition, which is felt by the even IT workers, so musculoskeletal disorders would be reduced. And as compared to conventional physiotherapy, I won't say conventional physiotherapy does not have an effect. Conventional physiotherapy, we land up giving patients some electrotherapeutic modalities like IFT, TENS, ultrasound, because it is spasm, because it is recurrent pain, reoccurrence of pain. but that won't give a long-term effect. Pilates and core strengthening, even core from the muscles which are affected. So toning up those muscles, improving the strength of those muscles would make a difference. Similarly, Park et al. In 2024 highlighted enhanced balance and functional outcomes in patients who undergo Pilates-based exercise. In Parkinsonism and in cases where there was spinal surgeries were being performed, and there was a kind of hemiparesis also for few of the patients. So functional outcome, SF36 questionnaire, when we saw that when the researchers saw, when the researchers saw, they realized that yes, there is functional outcome is improved, and the activities which the patient was not able to do is able to perform activities smoothly. Any movement which we can perform smoothly does make some difference. These findings, they reinforce that Pilates as superior and evidence based approach in clinical physiotherapy practice. Next slide, please, ma'am. Next slide, please. Yeah, thank you. Integration in physiotherapy practice. Clinical Pilates follows an assessment-driven approach. Uh, no, the previous one. The previous one, ma'am. Yeah, thank you, ma'am. Clinical Pilates follows an assessment-driven approach where individualized treatment is planned based on thorough evaluation of patients' conditions and goals. It can be mat-based or equipment-based. As I said, that there are few of the equipments, reformer, Pilates trainers. So they use these equipments to enhance the movement control. But yes, we physios can even give it in our OPD, in the equipments or in the facility which we are having, if we make the patient realize that how important it is to engage the core during any exercise, plus resistance and support as needed. A strong emphasis is placed on goal setting and active patient engagement. This is not a passive treatment. Pilates is something which needs interaction, time to time interaction of the therapist with his or her patient, that how are you feeling, is it working for you, and we'll make sure that we motivate our patients so that they give us a feedback which makes us realize that yes, the exercise are being properly taken up by the patient, encouraging motivation and adherence to the therapy. It is draining. Pilates is indeed draining. The exercises, the treatment, or the hundreds, when we are asking the patient to perform the exercise, which I just showed to you, the hundreds, it is tiring also, and it is the patient would feel that I'm just getting sore day by day, my muscles are aching, but no, it helps. So progress is monitored regularly and exercises are modified accordingly to match the patient's evolving capabilities and rehabilitation milestones. Next slide, ma'am. Next slide, ma'am. Yeah, thank you. So yeah, there are some myths about Pilates also. So let me just burst some of the common myths about Pilates, because believe me, even if some clinicians still believe that these may be the causes why people are not opting for Pilates or going for Pilates. So Pilates, it's not just light stretching. No, not really. Pilates is not about simply waving your limbs around on mat. Clinical Pilates specifically engages deep stabilizers, those unsung heroes like transverse abdominal, multifidus that keeps us straight and pain-free. Trust me, these exercises may look easy, but trying to hold a treaser position, the position which I had shown earlier, wherein the woman was, her hip and knee was a 90-90, and then she was trying to lift her entire torso up. So that is nothing but a treaser. So that exercise, it is not easy. I even tried it post-pregnancy, but it is not easy to hold it because, yeah, you can realize that now your core muscles are getting engaged and holding that position for even few seconds becomes little tough. So, next myth is it's not for elderly. No, 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 no. A person who is fit enough, who can do aerobic exercises, who can go for a walk. Aerobic exercises is far. You can go for a walk. Uh, so definitely he or she can go for Pilates training. And people, most common condition in India is osteoarthritis. Arthritis not only of knee but also of many of the joints. So arthritic changes patient can definitely do because uh, many a times they are being instructed, don't sit down, don't lift heavy weights. Make sure you're not sitting on the ground and you're sitting, taking support and then getting up. We would say that what if we try to train their deep stabilizers so that they would take the load and prevent the load on the extremities. So yes, an OA patient who is 70 plus can also opt for Pilates, and the brilliance of Pilates lies in its modifiability as per the patient's will, as per the patient's comfort. Pilates can be changed. One exercise of Pilates can be modified with two of the exercises of Pilates. So it is modifiable using a bolster, chair, or reformer support. Every movement can be tailored. In fact, it is fabulous tool for fall prevention and improving proprioception in seniors. Many of the cities, as I told this point earlier also, many of the cities, they have these yellow markations on the road. Why is that? Because the people, older age group, people doesn't realize they have this less visual acuity. So Pilates will give them at least a sense of awareness of their own body posture, and thus fall prevention will be achieved. Next slide. It is not evidence based. No, RCTs are being done on Pilates, and it is evidence based. It shows significant improvement in pain, balance, core strength, and even quality of life when Pilates is integrated into rehab. You might feel that yes, this session was completely on core or on these exercises, but let me clear this doubt. This session is actually on core, but we are trying to modify the extremities and make them also work along with your core. But yes, core cannot be left. Core exercises, core has to be engaged, and then only you can go for extremity strengthening. Let it be theraband strengthening, let it be any kind of other resistant exercises, any kind of other treatment modality along with this will give you beautiful results. So this is my favorite bust to myth to bust, that is when I get to quote recent RCTs from 2023 to 2024, research shows significant improvement in pain, balance, core strength, and even quality of life when Pilates is being integrated into rehab. So now onwards, we can take a step that whenever we are planning for any rehabilitation protocol, why shouldn't we include two of the Pilates exercises? We cannot randomly pick up any Pilates exercises. Those Pilates exercises has to be pertaining to the condition. So yes, taking two or three of the Pilates sessions during our traditional treatment protocol will definitely make a difference. And the next myth, the fourth myth is only for dancers, not for athletes. Next slide. Yeah, only for dancers and not for athletes. Sure, dancers love it, but so do the post-op knee patients, pregnant female, and people with Parkinson's would love to have a proper balance. So dancers, they still ballet dancers and all these dancers, they love to attain a good posture when they are dancing. So post-op knee patients, in them also you can give Pilates exercises. In pregnant female, yes, in pregnant female, let me be clear, you can give few of the Pilates exercises during her ANC phase and few of the Pilates exercises in PNC. Many a times there is post-pregnancy, like attaining the pre-pregnant state for the female. So Pilates works wonderfully. Its clinical reach is broad. We have seen results across ortho, neuro, cardio, and women health domains. Fifth myth is it is not an intense. It is not intense enough. No, if you go for 1 hour, as I said, it twice weekly, you can plan for your Pilates session. It is exerting, it is high intensity because not because of the repetition. Repetition is one part of it, but the postures which you are attaining, you are trying to achieve, attaining and achieving that posture and holding it for some time is little bit challenging initially. Later on, when you master it, is not tough. So, one of the session we'll revisit this myth, and Pilates demands precision. It demands core engagement and breath control. Inhaling and exhaling during the exercise plays a vital role in Pilates training. So it's gentle on joints, but tough on control and endurance. Whenever we are trying to give any of the strengthening protocol, the next day patient would come, what have you done? The pain has aggravated a bit. Though new recent advances are still there, I won't say that, but Pilates would help us to give the same amount of strength training, but in a conditioning way so that the patient doesn't come up with a new pain. So yes, it is helpful, and endurance is something which needs to be improved so that the patient's pain won't reoccur. So not only strength training, but endurance is on which Pilates works. So that's all, ma'am. I'm open for any kind of question or thank you so much.
So this was an excellent and educational session. We would like to thank ma'am for the and from the entire Physio TV crew for the amazing session. Thank you, ma'am.
Thank you, ma'am. Thank you. Thank you so much. Here we conclude the Pilates talk, and I hope it was easy for you all to understand. And thank you so much for your patient listening. And thank you for all the organizers. Thank you, Dr. Shivani ma'am and Sancheti Institute for inviting me for this session. And I'm really grateful. Thank you so much. Thank you.